Ross.
I'm Kayla Pittman.
And our project is on type 1 diabetes mellitus with considerations for Latino Americans. This presentation will go into special consideration, pharmacologic measures, and dietary interventions that may be needed to fit the lifestyle of somebody with type 1 diabetes mellitus.
What is type 1 diabetes mellitus? It's when there is an absence of insulin production and secretion of the beta cells. Hyperglycemia is over 250 milligrams per deciliter. Hypoglycemia is under 70 milligrams per deciliter. Symptoms of diabetes mellitus are polyuria, which is excessive urination, polydipsia is excessive thirst, and polyphagia is increased hunger. A common occurrence in type 1 diabetes is diabetic ketoacidosis. It is a condition in which blood sugars are consistently over 300 milligrams per deciliter. The management from a nursing standpoint is to initiate IV fluids, administer an insulin drip per orders, and closely monitor vital signs.
The IV fluid of choice is typically normal saline 0.9, and it's also important to monitor the patient's level of consciousness because this can be a big indicator of ketoacidosis and it can be a big side effect as well.
Pharmacological measures would include insulin that can be rapid-acting, short-acting, intermediate-acting, long-acting, and rapid-acting inhaled solution. Lispro Humalog is a rapid-acting agent. Regular insulin, Humulin R, is given 20 to 30 minutes before a meal, and Lantus is considered a long-acting. Following up with the previous slide, this is a chart about the insulins in more depth. The rapid-acting, like Humalog, is an onset of 10 to 15 minutes. The peak is 1 hour, and it's a duration of 2 to 4 hours. It is used for a rapid reduction of glucose control. And the short-acting, like Humulin R, is an onset of 30 to 60 minutes. It peaks at 2 to 3 hours, and the duration is between 4 to 6 hours. And it's usually given 20 to 30 minutes before a meal. The very long-acting, as Lantus, is an onset of 1 hour. The peak is continuous, and it's a duration of 24 hours, and it's used for the basal dose.
This slide is going to go into depth on the dietary modifications of a Latino American to fit the dietary needs of somebody with type 1 diabetes mellitus. So according to a cohort study conducted in 2019, Latino Americans have been deemed to intake an excess of processed meats and red meats. This can contribute to the double diabetes phenomenon, which is diabetes 1 and type 2. And it's also led to an increased risk of cardiovascular disease. Diet deficiencies depend largely on where the Latino American is based from, so there's places like Venezuela where their dietary modifications might be a little bit different than somebody from another area. So the recommended dietary modifications include increasing their intake of lean proteins, which this might be chicken, like grilled chicken, fruits, vegetables, nuts, beans, and yogurt, like Greek yogurt or something like that. So this slide is going to go more into depth on the carbohydrate classifications. So there's the monosaccharides, which are simple carbs such as glucose and fructose. There's the disaccharides, which are simple carbs also, and it's sucrose and lactose. And then the polysaccharides are your complex carbs, which contain starch, fiber, and glycogen. Glycogen is used as stores to come out of the liver whenever a patient or anybody has low blood sugar. It helps it regulate and bring it back up. Moving on to protein classification, there are complete proteins. These come from animal sources. It might be chicken, salmon, ground beef, anything of that nature. Then we also have our incomplete proteins, which are generally from plants. This could be chickpeas or tofu or anything like that. For macronutrients and micronutrients, a proper diet includes adequate intake of carbohydrates, fiber, protein, fats, and vitamins. An example of a carbohydrate would be something like chips or potato, anything like that. Fiber would be like a Fiber One bar, any sort of supplementary snack. Proteins would be our meats, like our chicken, our salmon. Fats might be peanut butter. And then vitamins can come from things like fruits and vegetables. Those with diabetes need to increase their dietary intake to include 20 to 30% protein, 20 to 34% comes from fats, and 45 to 60% comes from carbs. Moving on to vitamins, there are water-soluble vitamins and fat-soluble vitamins. The water-soluble vitamins contain vitamins C and B complex, like your B6, your B12, things like that. And the fat-soluble vitamins include vitamins A, D, E, and K. Vitamin C will aid in the healing process, so if you have a wound, it helps promote collagen growth. Vitamin B complex aids in cellular metabolism. Vitamin A aids in vision, specifically night vision. It helps those that are especially older be able to see at night better. Vitamin D aids in bone health. Vitamin E aids in the prevention of oxidation of vitamin A. And vitamin K aids in prothrombin synthesis. We have included some meal examples. These are actually from our paper that we made and just pulled from the text. So an example of a breakfast would be 2 eggs. 2 eggs equals 78 calories a piece. A slice of wheat toast, which equals 70 calories. A tablespoon of natural peanut butter. A half cup of cantaloupe, which is rich in vitamins. It has 27 calories. And then a glass of skim milk, which is also rich in vitamins and is 103 calories. So for a lunch example, there is 4 ounces of grilled chicken, 150 grams of green beans, and a cup of mashed potatoes. Then a dinner example would be 3 ounces of salmon, 1 cup of white rice, 1 cup of sliced avocado, and a whey-based protein shake. So the protein shake can be interchangeable depending on your dietary needs and preferences. There are whey-based, there are vegan-based, there's tons of different based protein shakes, but the bottom line is this helps increase your protein intake as well as your caloric count.
And these are our references.
We have the Brunner and Sedar textbook of medical surgical nursing, and we have 2 of the ATI books.